What causes urethra complications after prostate catheterization? Imagine trying to thread a delicate wire through a twisting, narrow tunnel. That's similar to what happens when a catheter is inserted into the male urethra, especially after prostate procedures. The urethra in men is a tube that runs from the bladder out through the penis, passing through the prostate gland. Because of this, any changes or issues with the prostate can make catheterization more complex and increase the risk of complications. One of the main causes of urethral problems after catheterization is mechanical trauma. The male urethra has natural curves and narrow sections, particularly at the prostatic urethra where the prostate surrounds it. When a catheter is inserted, if it meets resistance or is forced, it can cause injury to the urethral lining. This can happen if the catheter curls or kinks inside the urethra, or if the balloon is inflated too early or in the wrong spot. Inflating the balloon prematurely or in the wrong position can exert pressure on the urethral walls, leading to tissue damage or even creating false passages, which are abnormal channels that can cause long-term problems. Repeated or forceful attempts to insert the catheter can also cause scarring, leading to narrowing or strictures, which make future catheterizations more difficult and can cause ongoing issues. Infection is another common cause of urethral complications. When a catheter is placed, it can disrupt the natural defenses of the urethra and bladder, allowing bacteria to enter and multiply. This often results in urinary tract infections, which are the most frequent complications linked to catheter use. The longer a catheter remains in place, the higher the risk of bacteria traveling along the outside of the catheter or through its lumen, leading to inflammation and tissue damage. Over time, these infections can cause swelling and scarring, which may contribute to the development of strictures. Inflammation and fibrosis, or scar tissue formation, are also key factors. When the urethral lining is injured by trauma or infection, the body responds with inflammation. This process can lead to the formation of scar tissue, known as fibrosis, in the spongy tissue surrounding the urethra. Over time, this scar tissue causes the urethra to narrow, creating strictures that block or slow urine flow and make catheter insertion more challenging. These strictures often requiring medical procedures or surgery to correct. Other factors can also contribute to complications. Bladder spasms caused by the catheter can lead to discomfort and urine leakage around the catheter. Poor catheter care, prolonged use, and patient-specific factors like age or a weakened immune system can increase the risk of injury and infection. In men with prostate enlargement, tumors, or prior prostate treatments such as surgery or radiation, the anatomy of the urethra can be altered, making catheterization more difficult and increasing the chance of injury. In cases where catheterization proves difficult or complications develop, consulting a urologist is essential. They can provide specialized care to prevent further damage and manage existing issues. To reduce risks, healthcare providers emphasize using the appropriate size of catheter, employing gentle techniques, and limiting the duration of catheter use whenever possible. Proper training and careful handling are vital, especially in men with prostate problems, to minimize trauma and infection. Remember, every individual's situation is unique, and it's always best to discuss any concerns with a healthcare professional. They can assess your specific condition, recommend the safest approach, and help prevent complications related to urethral injury after prostate catheterization.